Welcome to Startup Health Now, the weekly web show that celebrates the healthcare transformers and changemakers reimagining healthcare. My name is Unity Stoakes, and I'm honored to have a conversation today with Esther Dyson, who's not only an advisor and investor in Startup Health, but really one of the most innovative people in the industry, one of the most active angel investors in digital health and healthcare today, and also named recently by Forbes as one of the most powerful women in American business. So we're going to have a great conversation today. Stick around.
It is the duty of leaders to lead, of the creative to create, of the daring to do. The free world expects leadership of us. Its fate and our fate depends upon our leadership. We are industrious, inventive, restless, with the fires that burn within us. Well, I say that nothing is easy, and the best things are the hardest. And all our troubles, all our immense difficulties, now and in the future, can I say be solved if we have the will, the courage. The future is to those who take it.
Welcome, Esther. It's wonderful to have a conversation with you today. We're here at Health Datapalooza. I think it's the 5th or 6th year, and it's really turning into quite an ecosystem, quite a community.
A big show.
I thought it'd be wonderful to start the conversation today just about data itself, and I'd love your perspective on why is data important to our health?
Well, data is what lets you know whether you've got health. It lets you know in advance if you're doing something wrong. It lets the health system understand how effective they are or ineffective. I mean, it's both for individuals and for healthcare companies and for communities, which is my interest. It's the measurement thing. It's like, weighing yourself if you're a person, counting your money if you're a company, checking your mileage or checking how much gas you have left if you have a car.
So true, and it seems like for so long we haven't had access to our own data, just as individuals, right. Certainly. I mean, we can get on a scale, we can have access to our bank account.
Yeah, but not our genome, not our health records, and what we certainly can't get is the whole picture, because you get each piece on a fax that you can't match up to another fax if you can read it.
So are you optimistic about either where we are today or where things are heading?
Yeah, I'm really optimistic, partly because once you acknowledge the problem, it gets much easier to solve it, because people say, oh my God, this is crazy. It takes a long time in healthcare, but it is genuinely beginning to happen. And
why do you think things are beginning to happen now? Is it because of, it seems like the Health Datapalooza and people that have been in government, and it seems like people in the startup ecosystem and people in industry, it seems like there's a lot of different perspectives and collisions going on. From your perspective, why are things starting to change now?
Because all those things are aligning, and also what's happening is individuals are using Fitbits and Apple Watches, and they're saying, how come I can get this, but I can't get what I pay hundreds of dollars for? And even the doctors, the old doctors don't necessarily use this stuff that they're changing, but the young ones are used to iPads and cell phones, and they sort of...
It's part of their lifestyle.
Yeah, it's like, I can get my money out of the bank and merge my accounts and sort of see my overall spending patterns and discover how much I spent on groceries, or I'm spending more this month than average and I should watch out. Why can't I do that with the data about me?
It's interesting. It's one reason why I love seeing so many entrepreneurs that are coming from outside of healthcare that maybe haven't been jaded by the last 20 or 30 years, and they're just asking that question, why? And I think that's a really exciting trend that we're seeing these serial entrepreneurs come over to healthcare. In your travels, are you excited by either the talent you've been meeting or the designers or the engineers? What's your take on the level of people you're meeting?
I'm excited by the level of people I'm meeting. There seem to be too many redundant ones, which is, the market will take care of that. but it's like I'd rather see 2 or 3 that really
Like
get to
companies that are
critical
doing the
mass.
same thing?
Yes.
Okay.
And that are pretty indistinguishable. You know, I'm part of what Startup Health does is help them do pilots and actually get beyond that stage of, oh, I've got a great idea, it's the same as everybody else's idea, to 1 or 2 of them will have critical mass and will end up being market leaders, and the others, you know, might be acquired by somebody or merge or, you know, pivot or whatever. But it's a phase the market goes through. I would say right now there are too many companies that are halfway there and not enough that are actually out there really making a difference at scale.
Is that a function of how the cycle generally exists, or is it somehow different in healthcare?
Yeah. No, it's a function of the cycle. It's not, oh my God, they're going to die. It's everybody gets a flu in the winter or whatever. It's just a typical thing that happens in any kind of market ecosystem where there were hundreds of car companies, and then they kind of consolidated,
Right.
and now there's a new set of them like Tesla and so forth, and so it goes through cycles. So it's not a sign of anything terrible. It still is slightly wasteful, but it would be a lot worse if there weren't any of these.
So if you were to compare it to other cycles you've seen, like say with the PC industry, where are we in the healthcare innovation cycle?
Or the health innovation cycle.
The health innovation cycle. And I loved how yesterday you had crossed out healthcare to
I've
just
got it
health.
here somewhere.
Yeah, that was brilliant. Yeah.
We're early. We're at the redundancy. People are beginning to understand the problem. So in a sense, the sellers are all understanding the problem and creating solutions. Not all the buyers understand that yet.
So
But-
is that, so the buyers are the industry, right?
Well, it will vary. It's the industry.
And
It could be
government.
employers, it could be individuals, it could be doctors themselves, and it could be third parties like food companies or you know, who knows?
So does the market expand to a certain extent? I mean, I personally believe that there's new types of health companies emerging.
Absolutely.
So you look at
Yeah.
Under Armour or Apple's becoming a health
Right.
company.
Yeah, it was great to see Under Armour here.
Yeah.
Yeah, the market, so the amount we spend on healthcare is actually very small compared to the market of things that influence health, both positively and negatively. And the amount we spend on cancer doctors, we hope will go down. And the amount we spend on healthy food that helps forestall cancer, we hope will go up. Or on environmental sensors that will detect toxins in the air, or personal sensors that detect if you're not exercising enough or whatever.
So I'd love to dig in a little around HiCCup and
Okay.
your initiative, HiCCup. Could you just give an overview of
Yes.
what HiCCup is and what the mission is?
So HiCCup stands for Health Initiative Coordinating Council, and its mission is to invest in health, or to invest in the production of health as an asset. Most people see
As
health.
a cost. Right?
Yeah, it's a cost. It's something you spend money on. And indeed you do. You spend money repairing it if you've let this asset get in trouble. But if you invest in this asset, you create resiliency. You basically invest in healthy human bodies.
And when you say you mean individuals, employers, communities,
yeah.
government, schools.
Right. Yeah, I mean, it's a collective investment, because what makes a healthy body is not just me eating, but it's food companies providing healthy food, it's schools providing healthy food and exercise, it's employers investing in their employees' health, and it's also bike paths and bicycles and sort of the built environment, and many of these things, health is just a component, but there is a way to invest in health, and then you reap the benefits later because you have these bodies that don't cost a lot of money, just the way, I have a bicycle, so my transportation doesn't cost a lot of money. That bicycle was an investment every time I don't need to spend $3 on a subway token or $20 on a taxi cab.
So this is a big vision.
Yeah.
I think you're starting with 5 Way to Wellville communities.
Right.
And what's the goal in those communities?
So we have 5 communities. They're under 100,000 each, and they were 5 out of 42 communities that applied to be a Way to Wellville community. So these 5 communities are Spartanburg, South Carolina, Greater Muskegon, Michigan, Niagara Falls, New York, Clatsop County, Oregon, and Lake County, California.
Wow,
And they're
very
not
diverse.
Yes, they're not the best 5. They're the best group of 5. So we wanted some variety, and
So that's an ecosystem unto itself.
yeah. So demographic variety, geographical variety, but most interestingly, the lead organization. What they needed was each community needed to have a bunch of organizations working together, but there is a lead. So in Niagara Falls, it's the mayor's task force for a healthier Niagara Falls. In Spartanburg, South Carolina, it's the Mary Black Foundation. In Clatsop County, it's the Medicaid company, Care Oregon. And in Greater Muskegon, it's the Rotary Club working with the local health system. So, and in Lake County, the Lake County Health Leadership Network. So we're kind of exploring different models, and these are obviously not clinical trials. Right. It's just, they're real places. But at the same time, you can learn from what worked and what didn't in each community. How are they the same? How are they different?
So
and
there's data in these communities that's coming
there's
out
some
of this.
data, and we're helping them to collect the data and to analyze it more effectively. And each of them, they all have obesity, diabetes, heart disease, mental health issues, a need for more early childhood education, prenatal care, dental health, et cetera. But they also have their own specific issues and specific capabilities.
So is this a 5-year, 10-year, 20-year?
It's 5 years renewable.
Okay.
We didn't want to go in with 10 years. It just seemed
So
like
it's
too big of a
bite-sized
chunk.
chunks,
But after
but
5 years,
evergreen.
yeah, after 5 years, we should have some real data showing some real stuff. But we won't be done in 5 years. HiCCup itself, the purpose is not to live forever as a foundation. It's to do this, make it self-sustaining and disappear,
Yeah.
and then have all the other communities steal our ideas and go do it at scale.
I love that.
Yeah.
So you'll know you're successful when?
When I walk down the street in Muskegon and I overhear a real estate agent saying, "It is so easy to sell houses here. People just want to move here. Employers find it easy to hire people to come here. The schools are great. Everybody around me looks healthy. I just love selling houses in Muskegon."
Yeah.
Yeah, and the mayor of Niagara Falls
It's like
was
a
saying,
magnet.
yeah, and obviously we're measuring much more precise things like incidence of diabetes and high school graduation rates and so forth. But if people don't know something has changed, we will not have succeeded. It's got to be at that visible level where it's inspirational to other people, and so people will say, "If those jokers at Muskegon could do that, so
Right.
can we."
Yeah.
And then they'll do it.
So what are you most excited about today, just in general? What's piquing your interest?
Well, it's sort of like I don't have a favorite community, and I also don't have a favorite program. It's the thesis here is that you could go to Greater Muskegon, you could do 20 different things. You could do diabetes, dental health, early childhood education, farmers market, hydroponic farming, open a new gym. You could change this. If you do 20 things, none of them, you probably won't do any of them well. These are
It's
small
too
places.
spread
They don't
too
have
thin.
capacity. Yeah, you just sort of, if you do one thing, it won't spread either. But if you do 4 or 5 things that interact, so the diabetes management program interacts with more exercise capabilities, interacts with the new federally qualified health center, and there's mental health services more broadly accessible, including, people don't usually just have diabetes. There's people have multiple health issues. They have transportation problems. So if we do 4 or 5 things as Wellville specifically, and then the community itself, it's not that Wellville comes in and everything else stops. Wellville comes in and inspires Other people, yeah, I'll open a new cafe. Somebody sees an opportunity to start a new rec center for high school kids. So we want to be part of a movement, not the only movement in town. And again, all of this is run by the people in the communities, not by us. We're just the way Startup Health helps companies accelerate and raise money and define their marketing and maybe pivot if something isn't working and reach out to partners. We do the same for community efforts under Way to Wellville.
So stepping out from sort of the local lens, what are you excited about just on a macro level? We're seeing just all sorts of change.
Yeah.
You mentioned Tesla earlier, people trying to go to space, batteries getting smaller and cheaper.
Well, I still have to talk about Way to Wellville a little more, and that's social impact investing.
Yeah,
so the way to fund this is you invest up front for returns that are longer term, and often governments can't or won't do that. But there are social impact investors who would love nothing better than a portfolio of 20,000 diabetes prevention, just the way you invest in a mortgage portfolio, a portfolio of diabetes management clients or something like that.
So are these individuals or funds or companies?
They're high net worth individuals. Ultimately, they're kind of social impact funds. It's still too new for pension funds and things like that.
Yeah.
I mean, in a sense, this is what insurance companies should be doing. But so there's a lot of interesting financial things. Separately from that, but not entirely, I'm really interested in hydroponic farming, and both for producing good food without pesticides, but also producing good food with 1/10 the water consumption. So we actually see that as an interesting investment possibility in several of these communities. I think overall, kind of food and logistics, 3D printing is not just, I can print a pretty shoe, or even I can print a fake arm bone, but it's going to change how waste management and logistics and production is handled. So it's going to have a big impact on transportation.
Does there become a moment, though, where this leapfrog effect takes place? I think about the mobile phone industry in India as an example, where they didn't have landlines, or banking's more sophisticated in places in Africa than the U.S. And we're at this conference where they're talking about interoperability challenges with data and these health records, and I'm wondering, well, maybe there just won't even be a health record anymore, just something that completely leaps beyond and simplifies the whole construct. Do we get there?
I mean, the way you don't have a money record.
Right.
You go to your bank and you get the information you need in whatever form you need it. Yeah.
Right.
We'll probably transcend the health record at some point.
And isn't that data, it's in our bodies, it's in our blood, it's in our DNA, it's in our weight.
But it's also useful external to us. I mean, it's very useful. So 23andMe has on the order of 1 million genomes, most of which have been consented to be used for research. And that's incredibly valuable outside of individuals. Right. It informs how you, as an individual, how you think, how you know about what your risks might be. Same thing with microbiome. I mean, it's great that this information is in you, but it's also really useful when it's aggregated somewhere else with other people's information, including their outcomes and the geographical information about where they lived. And so the whole point is it's malleable. You can have one individual be the center of the universe, or you can have one genotype be the center of the universe, or one disease be the center of the universe. Whatever sliver you want of this massive cloud of data you can get.
But do you think it's possible that one day soon, whatever that means, we'll go to some remote part of Africa where they literally don't have access to any care or any health as we define it, and they've leaped beyond because they've got 3D printing that's affordable. They have access to a connected world that's free. Does it leap beyond?
Maybe, maybe not. I mean, a lot of this depends on politics, and I've traveled a huge amount, probably 90 countries, and I've seen 95 different ways to run a country badly. So
There's a lot of other issues involved.
yeah, and again, it's access to clean food and to water. The third world health problems are still not being dealt with because, again, they're not individual problems. As an individual, I can buy a cell phone and join the economy in Africa. But in
can't
many
get
cases, I
water.
can't overcome the power outages. Again, it varies from country to country, but
Yeah.
I encounter a lot of, I would say, Silicon Valley optimism that I think
Yeah.
really misses what's going on in the rest of the world.
Yeah.
So, yes, there will probably be a lot better health data in Africa sooner than we think, including, when you get all kinds of non-invasive biomarker detection. But at the same time, the challenges there are fixing governments and economies. You can't
Right.
be healthy living in a lot of the places I've been to. And that includes many parts of the U.S., but it also includes a lot of emerging markets and so forth.
So, what advice do you have for entrepreneurs? There's a lot of entrepreneurs running around this conference.
Oh,
You meet
really?
That's one of the good things because
Yeah.
5-6 years ago, when there was just 45 people, there wasn't. But lessons learned. I loved the discussion around Way to Wellville and HiCCup because it brings it down to a very practical, tangible, local level. What could or should entrepreneurs be doing in today's environment getting started? You mentioned earlier there's too many of the same things as one example. Any words of wisdom on companies just starting out or trying to
Yeah.
get off the ground?
Well, one is, don't focus on innovation, focus on usefulness. If an innovation will make you more useful, that's awesome. But innovation is not inherently valuable. Useful innovation is. And the second is focus on implementation. What is it that you've achieved? Focus on doing something specific. I talked to a guy here who is helping with one kind of Medicare Advantage billing problem. That's great. He can solve a real problem, and he will earn money doing that. And then he can expand and do other cool things. But you really have to be focused before you're too ambitious. We're focused on 5 places. I would
And
love
then
to.
only 4 or 5 things in those places
Yes,
as well.
we would love to do everything, and we would love to work with all these people, but these communities, they can't support
Right.
10 different apps. And so we will be much more effective if we help these communities get to the point where later on they can do more. And if you want to do the same thing we're doing, bless you, because there are lots of other communities that need it. But we can't do it. We need to focus because we have limited resources. Every startup has limited resources. And so they should solve one problem well rather than get distracted by 10 problems.
So that's the advice for the startups. What would your advice be to CEOs of, say, any of the top 100 largest companies in the world?
Well, one clearly is invest in the health of your employees. 2, if you sell anything like food, make it healthy and figure out how to make money making it healthy. 3, if you're not doing something useful, go join a startup that is. Take all your skills and try something else. But fundamentally, large companies like large communities or large governments have a huge amount of resources, but a lot of inertia. And so your challenge as a CEO is to excite the people in your company and to disrupt yourself before someone else does that for you.
Mm-hmm. So one last question. Have you read any good books recently that you would recommend
Yes.
other people?
Oh, absolutely.
read?
So quite a bunch. And you can stop the camera when
No,
you want.
keep
But
it
one
going.
is called Scarcity by Sendil Mullainathan
Okay.
and his co-author, whose name I forget right now.
We'll add links in the show notes.
It's called Scarcity, and my Twitter review of it was to explain scarcity to rich people, talk about time, not money.
Ooh.
But
It's like Seneca, the philosopher.
whatever. It's all about how poor people are not stupid. They have, and it explains what scarcity does to decision making and how effectively you make decisions, and sort of everything from, if you're short of money, you might, take a loan that you can't pay back. If you're short of time, you'll stay up all night, and then it's even worse when you take the test the next morning because you lost all the sleep. So it's a very good explication of the realities of being poor, and a little bit about being time short, like a professor such as Sendo Mullainathan himself is. Another one is Juan Enriquez, Evolving Ourselves, which is about sort of we control our environment so much that we're controlling how we evolve, and we're also changing the fitness landscape, if you like. And it's everything from, again, the kind of food we no longer need to prioritize for being fed. We probably need to prioritize for not eating too much, but our bodies didn't evolve to do that. Genetic engineering, lots of really interesting, both scientific and ethical questions.
Now there's all these VCs investing in like food drinks or fake food.
Yes, and I think somehow that misses part of Maslow's hierarchy.
Like taking a moment to enjoy eating.
Another really interesting book is Antifragile by Nicholas Taleb, the Black Swan guy.
Yes.
It's sort of about resilience and kind of basically the difference between being alive and being, not dead, but simply not alive. Living things, they thrive on stress to some kind of tipping point, and then it destroys them. And that's obviously human bodies, but also minds and everything else, and also cities and ecosystems, communities. Whereas physical, built things, constructed things are fragile. They shatter and break.
I think if you left, I read this once, New York City, and there were no people there, you'd come back 20 years later and the entire city would have collapsed into the water.
And it would be green.
And it would be green, yeah.
Yes.
We would have regenerated into
Right.
something.
Yeah. Another one is my brother's book, which is about basically the and synergistic development of the computer and the bomb back in the 40s and 50s. It's called Turing's Cathedral by George Dyson, and is really wonderful.
Wonderful. We'll definitely put that on the list.
What else? I'm trying to... Christine Connelly. It's a wonderful book about the genome.
Okay.
And I can't remember the title, but you can put that in the
We'll
link.
find it.
Christine Connelly. And
Okay.
it's sort of it's kind of the non-medical, it's more ancestry focused, but what we've learned through genealogy and genetics, and it's really also a wonderful book.
Do you find yourself reading more books or more blogs or Twitter or everything?
Well, I read everything. I read newspapers. I don't watch TV at all. And since I discovered Audible, which I actually discovered about 2 or 3 years ago, because I couldn't read my brother's book. It weighed 10 pounds. I kept carrying it around. Finally, I got the Audible version and started listening, and I loved it. And then I realized, boy, this is great. Madeleine Albright's autobiography was also wonderful because she read it herself and got all the Czech names
And
right.
you feel, there's more to it than just, there's her voice in it.
Yes. And Thinking Fast and Slow by Daniel Kahneman.
Okay.
So those are some.
You got a good summer reading
Yes.
list here.
Yeah, it's great.
I love it.
I'm learning so much. Oh, and in The Land of Hungry Ghosts by Gabor Mate about addiction, and he's basically a doctor who worked on the sort of seamy side of Vancouver and tells the stories. And this was kind of early when people were just beginning to understand adverse childhood experiences and the connection of that to addiction. So that was very enlightening for me in terms of some of what Wellville is dealing with.
Do you find yourself getting ideas from books and then taking parts of those and mashing them into things, for example, you're doing with Way to Wellville? How does it
Yeah.
work for you?
I mean, it certainly informs my thinking. If it didn't, it wouldn't be
Right.
worth reading them.
It's
But
not just
you know,
entertainment.
the book about scarcity obviously is very relevant.
Yeah.
Turing's Cathedral is probably more relevant to some of the startup stuff I'm doing than to Wellville.
Yeah.
But just understanding.
You know, it's interesting. I think so many entrepreneurs, and they're caught up in their startup running 1,000,000 miles an hour, not getting enough sleep, not eating, drinking fake food. And there's other things that actually create opportunities to create by taking a break to read or listen to a book
Yeah.
or eat a meal.
Well, it's kind of, so there's an interesting argument that religion is good for people. And, you know, I find that, I don't think that's a reason to be religious. I kind of find that offensive.
Right.
And I would almost say in the same way, you know, books are good for your startup, but they're just inherently good in themselves.
Right.
And
Yeah. So is
you'll,
eating.
you'll be a better person. And, you know, probably you'll be a better startup person, but just fundamentally being a better person and being more aware of the world around you, even if it doesn't help your startup, is
Have too many
what you owe
entrepreneurs
to
lost their way in the sense they're all in on a particular mission and not open to other aspects
Yeah,
of life?
But that's, yes, but that's not specific to entrepreneurs. It's people in general. I mean,
Right.
I think, honestly, one of the most important messages is you're not a failure if you're not CEO. You know, entrepreneurs need teams. And the thing that disturbs me most about Silicon Valley is this kind of hagiography around Evan Spiegel and Mark Zuckerberg. And you really can live a very fulfilling life working for someone else. Yes, it's cool to be a startup guy, and they are mostly guys, but you're not a failure if you're not. And I think it's really important to understand that if you're a really great product designer and you don't want the hassle of being CEO, go be a great product designer. Don't feel inadequate. And me personally, I'm not a CEO. I have a CEO who runs HiCCup because I'm good at some things, but I'm really not good at running even a nonprofit startup. You know, and it's really important to do what you're good at and not to do what you think will make you more socially successful or richer or whatever. Just do what you can really do well and that fulfills you and where you can be the best.
Well, thank you so much for sharing your time with us today and your wisdom. And also for being such a supporter of startup health and the entire ecosystem. It's just so meaningful. And if people want to support Way to Wellville or HiCCup, where should they find you? HiCCup.org?
HiCCup.co.
.co. Okay.
Yes. And I am Dyson at HiCCup.co.
Okay, wonderful. Well, thank you
Great.
so much.
Thank
We
you.
really appreciate everything you do.
Good.